We'll start the session. Hello everyone. Welcome back to the another special EPIGNOSIS of the White Army. Today we have a basic quiz to know more about ENT. The prelim very overwhelming response today. More than 500 participated in the prelims round, conducted between 2 to 20 am. Among them, we selected 4 contestants for the finals. Okay, 4 the best participants are selected for the finals, and 2 are privileged contestants in the finals. So if the 4 main contestants, if they can't answer, the questions will directly passed on to the placed contestants. So, and we keep the rules very simple. There is no negative things, no past questions. Okay, there will be 4 rounds, and rounds are very simple ones. Okay, so keep it very simple, and we'll have a very interesting quiz today. Okay, keep it simple, and it make it a good learning experience for all of us. Okay, so in the first place today in the prelims we have can you please participants, can you please introduce yourself, a name and which college you are from and which year? First
Myself Aditi Vishwanath Malji from Dr. Vaishampan Memorial Government Medical College Solapur. I'm in pre-final year, 3rd year.
Very good, very welcome to you, Aditi. Next.
Thank you,
sir. I am PS Krishna. I am from AG Institute of Medical Sciences, 3rd year.
Mangalore. Welcome to Krishna. And 3rd place, Ashwin.
I am Ashwin from Mysore Medical College, 3rd year.
Very good. Welcome. And Narayan Murthy.
This is Narayan Murthy Ganesh from Coimbatore Medical College, pre-final year.
Okay, nice. You all had your food now? You're all ready?
Yes, sir.
Not hypoglycemic. Huh?
Yes,
be very
sir.
confident. Okay, be relaxed. Okay, no thing. This is not a competition here. You see, you are the best ones. See, this is almost an all level quiz. We have in in a White Army we have 1,000 students. Most of them attempted this. Among them, you are almost best. So be confident. Okay, feel free, feel relaxed. Okay, we'll have a very interesting questions coming up for you. So today's quiz we organized and conducted. Our quiz master for the days are one of our 4 members of the White Army, a very active member, in fact, Miss Raheja, who is a 3rd year student at BGS Global Medical College, Bangalore. And welcome to you, Miss Ashna Raheja, and congratulations for taking up this quiz for our other members.
Thank you, sir.
Yeah, and also moderator of the quiz will be Miss Priya Ashok, who is also 3rd year student at MS Ramaya Medical College, Bangalore, and also a core member of White Army and a very active member. Welcome to you, Miss Priya.
Thank you, sir.
Yeah. So Ashna, without any further, we'll start the quiz. Please, over to you.
Yes, sir. Thank you, sir. Hi. First round. The next slide. Okay, so the first round for all of you is the radiograph round. Each participant will be given 2 questions based on X-ray radiographs, which they'll have to answer in a span of 30 seconds. There'll be 10 points for each correct answer, and there's no negative marking and no pass marks. The order in which the questions will be put will be, the first question will be put up to Aditi. Second question.
Ashna, we can't hear you.
So is it fine now? I'm really sorry.
You can stop your video.
Okay, sir. So I repeat the rules. Each participant will be given 2 questions based on X-ray radiographs, which they'll have to answer in a span of 30 seconds. 10 points will be given for each correct answer. There is no negative marking and there are no pass marks. The past questions will be answered by our privileged participants and the audience. The sequence in which we'll put up the questions will be, the first question will be given to Aditi, second question to PS Krishna, third question to Narayana Murthy, and fourth question to Ashwin BN. And upon that, the audience questions will be given to our privileged finalists and the audience. We may begin with the first question put to Aditi.
Sorry to interrupt, Ashna. We have not introduced our privileged contestants, Akshay and Sukshma.
Sukshma.
Please, please. Akshay is one of my favorite juniors from KIMS Hubli.
Yes, sir. Myself, Akshay Hegde. I am a third year student from KIMS Hubli.
Yeah. Welcome to you, Akshay. And Sukshma?
Thank you, sir.
Hello. Yes, Sukshma, you're audible. Your introduction, please.
I'm Sukshma BR. I'm studying in third year in MS Ramaya Medical College.
Okay,
Fine,
that's
we can go ahead, Ashna. Please start.
okay. Thank you, sir. We'll have the first question for Aditi. Identify the condition based on the given X-ray radiograph. And your time starts now.
Juvenile nasal angiofibroma.
What a start for the quiz. Wonderful.
That's great. Priya, can we have the answer, please? That's correct. It's juvenile nasopharyngeal angiofibroma. Second question to PS Krishna.
No, Aditi, can you tell something more about that? Their name?
Sir, the posterior
how you
wall
made
of
the diagnosis? What is the feature?
Sir,
You saw in the
posterior wall
radiograph?
of sir, posterior wall of the maxillary sinus is pushed anteriorly. There is growth
What's the
seen
sign
in the area of antral sign or Holman-Miller sign.
Wonderful. Okay. So it's mainly seen in whom?
In young males, mostly. They present with recurrent episodes of epistaxis.
Okay. It's a very important question. Okay. The clinical case can also be kept for the exam, or else in theory it is invariably asked. So be prepared for the question. Next.
Next question is for PS Krishna. What view is depicted in the diagram below? And your time starts now.
Schuller's view.
Okay, that's great. Can we have the answer, Priya? That's correct. It's Schuller's view. Would you like to tell us something more about Schuller's view?
Yeah, Schuller's view is to look for the mastoid hair cells.
So useful in diagnosing which condition usually?
Mastoiditis.
Okay. What other views you know? X-ray views in ENT?
Yes, sir. Waters view, sir. Occipito-mental view. Then,
Wonderful.
Then Cardwell Luke view. Occipito-frontal view. Hello. Yeah.
Yes, you're audible.
Yeah. Then yeah. Then.
Okay, that's great. That was a good list that you gave us. Can we have the answer, Priya? Great, that's the correct answer. Now we go to the third question to Narayana Murthy. Identify the given condition. And your time starts now.
Achalasia cardia, rat tail or bird beak appearance.
Okay, that's great. Priya, can we have the answer, please? That was a correct answer. Narayana, would you like to tell us something about the condition, the peculiar feature?
Barium swallow shows rat tail appearance. CCK screening. It is implicated as autoimmune disorder or HPV, and HPV is mostly implicated. And then it's also associated with the parasitic orders are called. It's just
Chagas disease.
Chagas disease, yeah. Sorry. It is associated with Chagas disease. Then
okay.
What's the difference between Hirschsprung's disease and this achalasia cardia?
Achalasia cardia is the myentic plexus is lost. This thing, megacolon or Hirschsprung's, both the submucosal plexus as well as the myentic plexus.
Any other difference in the X-ray maybe?
X-ray, this that shows the affected part shows constriction. Yeah, both.
Very good. Which one? That one.
Hair springs, sir.
Huh?
Hair springs.
In this case, the affected part dilated.
Part shows dilatation.
Very good. Very good. Next.
Okay, that's great. We have the next question to Ashwin BN. The given is a HRCT image of ear. What condition is depicted? And your time starts now.
Ashwin, you know the answer. You are thinking rightly. Come on.
10 more seconds to go.
Take a guess. What are the common conditions in ear?
Otosclerosis.
Can you take one more chance? Ashna?
Sir, can we pass this question to the privileged participants?
No. Whether I ask him whether he want to take another chance. Okay, fine. Akshay or Sukshma?
Cholesteatoma.
Ashna, can we consider that?
Yes, sir. Can we see the answer, sir?
Yeah, no. Yeah, fine. Good, Sukshma. It's a cholesteatoma. Okay. What is cholesteatoma?
Squamous epithelium in the middle ear.
Okay, so you know that. So you've not seen the radiograph of that, right? You know everything about cholesteatoma, but except for the radiological appearance. Okay. Today you learned about that also. You'll never forget. Am I right, Ashwin?
Yes, sir.
Yeah, you'll read more about cholesteatoma today. Okay. Good. Next question.
The next question is for Aditi. What view is given in the X-ray radiograph taken below? And your time starts now.
It is Waters' view with mouth open. Also can also be called as Peary's view.
Okay, that's great. Can we see the answer, please?
Okay, good. Next.
That's correct. It's Waters' view. Can we have the next question? You have to comment on the arrowed part on which the arrow is put.
Yeah. Inferior turbinate hypertrophy.
Okay, that's great. Can we have the answer, please? It's correct. The inferior and middle
What condition we get this usually, Krishna?
Sir, a deviated nasal septum.
Why?
This part becomes roomy, sir.
So this part, that part, no, you can't.
So yeah, the
examiner here, and you should explain.
The part which is deviated, there is enough space, sir, to hypertrophy to be.
Anyone else want to attempt?
Compensatory hypertrophy of the opposite side.
I can't hear.
If there is weakness to one side, there's compensatory hypertrophy that gets on the other side.
Sir, I have emergency here. So please post the quiz, sir.
Okay, fine. Next question, please. Sorry, our quiz master has got some emergency. Something happened there, so she has to leave. So we'll continue. Okay, Priya, can you please continue? Priya, are you there?
Yes, sir, we can continue.
Yeah. Can you please continue next?
The next participant is Mr. Narayana Murthy. This question is for you. What abnormality is shown in the figure below?
Yeah, deviated nasal septum, and that is a septal spur.
Okay, we'll go to the answer. That's right. So, do you have any other question for him? Patient, sir? All right, we'll go to the next participant, Mr. Rashman. This is your question. What procedure has been done on the patient on the X-ray radiograph below?
Tracheostomy.
All right, we'll see the answer. You're right. So the next question is going to be to the audience. Before we begin, I'll just come back in a minute. We're trying to reconnect to Kishan, sir.
Yeah, Priya, next question, please. So for the audience, anybody can answer. First, it will go to our Akshay and Sukshma, and others can answer in the chat section. Okay. Yeah. Question, please.
Yes, sir. Which sinuses can be best visualized by the given view?
First, tell us the view, and then you can tell the which sinus. Akshay or Sukshma, can you try?
This is Cadwell's view. Frontal sinus can be visualized clearly in this view.
Okay, good. Akshay, what do you think?
Sir, frontal and ethmoid sinuses.
Okay, fine. Any what are the condition is useful in? Tell me some conditions.
Osteoma of the frontal sinus.
Okay, good. Most commonly?
Frontal sinusitis.
Yeah, that's very common one, no? Especially in students, young boys and girls, we can see this mimicking a headache. Okay, most commonly they present with headache. Most of how do you look for sinusitis clinically? What do you do?
Tenderness of the paranasal sinuses.
How do you do? How do you check? Because you had less clinical exposure this time, so we want you to know whether all this, how to test and all. Very common.
Maxillary sinus can be palpated in tenderness can be elicited in canine fossa.
Okay.
Then
frontal sinus, how you elicit?
Frontal sinus just above the medial end of superior to the medial end of eye.
Okay, you just gently press over that area, right? Press over that. If the tenderness is present, then you can infer that it's a sinusitis, frontal sinusitis. Very good. Next question, please.
Where is the foreign body stuck in the given radiogram?
Anybody can
answer. This is
answer.
also not a question.
Esophagus.
Is it in the esophagus?
Yeah, you're right. How can you tell it's stuck in the esophagus?
I say it's trachea. Ashwin, I say it's trachea.
Trachea bifurcates.
Okay, that's okay. This is a very big one, so it's very easy one. What if only that is the only fork, like only one part of is there? Then how you
tracheal rings.
In PA view.
No.
Sir, look for the tracheal shadow.
Okay, that's
and tracheal rings.
Any other?
In esophagus, you can see the whole length of it. Lateral length of it.
Point the most common foreign body. If it's
coin
there
or
in the
batteries,
upper part of the
coin batteries.
Yeah, point batteries. If it's present in the upper part, then how do you infer whether it's a trachea or esophagus?
In esophagus, you can see
Someone asked
the
already.
width of it in esophagus, whereas in the if it's dislodged in the trachea, you can see only the lateral view of it.
Well, you should take the
Lateral
lateral
view,
view. In the
yes.
lateral view, you can clearly make out, right? Not in the AP view all the time. AP view, like he told, if it's only width, if it's more than the trachea, only then we can make out it's a esophagus. Otherwise, it's difficult. Okay, so we'll take a lateral view to tell whether it's a esophagus or trachea. Very good. Next question, please. Second round.
Yes, sir. So I'll announce the results before we go to the second round. So at the end of round one, Ms. Aditi has 20 points, Mr. Krishna has 20 points, Mr. Narayana has 20 points, and Mr. Ashwin has 20 points. No, sorry, 10 points.
So good going. Good start for all of you. So we'll go to the second round.
So second round is identify it, where each participant will be given 2 questions based on instruments, which they'll have to answer in a span of 30 seconds. 10 points for each correct answer and no negative marking and no marks on passing the question either. So first question to Miss Aditi, identify this.
It is therdicum nasal speculum for anterior rhinoscopy.
You're right. You get 10 points.
Identifying points? No. Tell me two identifying points, okay, of each instrument. Only then you can get full points. That's correct. Answer is correct, but how do you identify that and use us?
Sir, the vertical, the blade, looking at the blades.
Okay. What's the use?
And it is used for anterior. It is used for anterior rhinoscopy to visualize the turbinate, inferior turbinates floor of the nasal cavity and a part of septum.
Given, you should know identifying features. That's 2 identifying features and 2 uses at least. Okay. At least this much you should know for every instrument. Next one, please.
Second question is to Mr. Krishna. Identify this.
Not sure. Freer's elevator. Freer's.
No. Sir, can we pass the question?
No, take one more chance. Take one more chance. It's a bit difficult. Krishna, if you want, you can zoom the screen also. You will see clearly. You can yourself zoom and see. Okay.
Not sure.
Anybody else?
Jobson horn probe.
Sir, it is probe.
No,
Sir, is it sinus ostium probe?
No.
Sinus ostium.
Kunj, are you there? If nobody answers, then Kunj will answer. Others can answer in the chat section also. Okay. Vishab is there. Vishab, Niharika. Okay. Tell the answer, please, Priya.
That's McEwan's curette.
Okay. Next question, please. McEwan's. What other McEwan's you know? Anybody?
McEwan's triangles.
Yeah, what is the McEwan's triangle?
It is a bony landmark for the mastoid. And, it is bounded by the temporal line superiorly. Then tangent drawn to the external auditory canal and the posterior part of the external auditory canal.
Very good. You are prepared well. Next question.
This question is for Mr. Narayana Murthy.
Grommet.
You're right. Do you know the types of grommet, which condition it is used?
It is used in SOM. I don't know the types of grommet.
Okay. And do you know where the grommet is placed?
In the anterior inferior quadrant, because it's the most dependent part.
Why is it placed there?
Yeah, because it is the most dependent part. It replaces the function of incision to drainage as well as ventilation can take place.
Yeah, that's right. Okay. Fourth question to Mr. Ashwin.
Posterior rhinoscopy mirror.
What are the features to identify this?
It has the bayonet in the handle, whereas the ideal mirror is straight. It does not have that bayoneting bend.
Okay, and what is the name of this mirror?
St. Clair.
There is a name. Yeah.
St. Clair Thompson.
Yeah, you're right. It's St. Clair Thompson's posterior rhinoscopy mirror. Okay, moving on to the second set of questions for the same round. Miss Aditi, this is your question.
It is indirect laryngoscopy mirror because
Okay,
it is having a straight handle. So,
yeah, right. Okay.
for indirect laryngoscopy.
All right. You get 10 points for this. Next question is Mr. Krishna. Identify this.
Yeah, it is Luke's tongue depressor.
Okay.
Yeah, it is used to depress the tongue while doing posterior rhinoscopy.
Okay, you get points. You get 10 points for this. The next question is Mr. Narayanamurthy. Identify this instrument.
It's a mastoid retractor.
Well, no, this is not a mastoid retractor. Do you want to take another attempt at it?
No.
Okay. Mr. Akshay, Ms. Sukshma, do you want to attempt?
It is Doyen's mouth gag.
Yeah, you're right. It's a mouth gag.
Yeah, it looks similar to the mastoid retractor, but the blades are different. See, mastoid retractor have a 3-4 blades at the end, but here it is rounded. Okay, just to retract the mouth. So that's the difference. So look all the each part carefully before answering. Okay, even the surgery also 2-3 instruments are very close and very confusing. So before that, just look carefully into the each part of the instrument. Only then tell the answer, please. Okay, good. Next.
Next question for Mr. Ashwin.
Oral speculum.
You're right.
It is used for otoscopy to visualize the tympanic membrane.
You're right. Can you tell me the features of a normal tympanic membrane, how it appears?
Normal tympanic membrane has the handle of the malleus and cone of light.
Where does the cone of light fall?
In the anterior-inferior part.
Okay. You'll have to describe more on the normal tympanic membrane, a lot of features. Okay. I'll go to the next question. I'll give you points. You get full 10 for this. Next is the audience question. Identify the given instrument. Mr. Akshay and Ms. Sukshma, you can answer this.
Is it
Anyone
Killian's
answering this question?
Killian's forceps?
No. Ms. Sukshma?
Priya, some answering in the chat section also. You can consider them also. Okay.
Oh, I cannot see the chat section, sir, while sharing the screen.
Kunj is telling Tillis nasal speculum. Is it Tillis nasal speculum?
No, it's not Killen's nasal
No, Kunj.
speculum.
I'm sorry. Priya is telling it's not. Priya's
It's
decision
not
is
asked
final.
forceps also.
Siemens nasal forceps. Something.
No, it's not a nasal instrument.
Tonsil holding forceps.
No.
Okay, Vijay
Luke's
Balaji will answer
forceps.
now. Vijay
What?
Balaji will answer. Balaji? Balaji is there, our mentor today. Vijay Balaji will answer. Can you unmute Vijay, please? Priya, make him co-host.
I cannot change. If I stop sharing
Okay,
screen
Vijay.
only, then I
Okay,
can do the other.
unmuted. Okay, Vijay unmuted.
Okay.
Okay, tell the answer, please.
It's a tracheus tracheal dilator.
Okay, okay. What other trousers you know? Aditi, what other trousers? Yeah, what is
Trousers
in
trousers sign?
hypocalcemia.
Okay.
Trousers sign
What
in
happens?
hypocalcemia.
And one more, two trousers signs are there.
Migrated thrombophlebitis, the pancreatic cancer.
Where you see that?
Yes, in
Pancreatitis.
pancreatitis or glucagonoma.
Pancreatic cancers. Okay, and what is trousers sign? Another calcium. What happens? Tell me.
When we try the blood pressure cuff and elevate the pressure, there is a spasm of the
Carpopedal spasm. Okay.
carpopedal spasm. Yes,
What is
carpopedal.
trousers sign?
Enlarged left gastric supraclavicular node in case of GML, stomach carcinoma.
Don't get confused. Okay. Trousers is a virtuous node, and this is trousers. Very good. Next.
Another question for the audience. Identify this instrument. Anyone taking this question?
Fiber optic laryngoscope.
No, it's not a laryngoscope.
Flexible endoscope.
Rigid endoscope. Yes.
There's a specific name for this. I mean, it's not named after someone, but the instrument is called something. Kishan sir, nothing on the chat box?
No answer so far.
Okay. It's a nasopharyngoscope.
Okay.
Okay. So at the end of round 2, so for round 2, Ms. Aditi gets 20 points, Mr. Krishna has 10 points, Mr. Narayanamurthy has 10 points, and Mr. Ashwin gets 20 points. Okay. So I'll go to round 3.
Yeah.
Round 3 is incisive, where each participant gets 2 questions based on incisions, which they'll have to answer in a span of 60 seconds. 10 points for each correct answer. No marks on passing, and there's no negative marking either. So the first question is identify this incision. Miss Aditi.
Rosen's incision.
No.
Or Lampert's.
Yeah. Okay.
Lampert's.
I'll give it for Lampert's.
Sorry.
It's Lampert's incision.
Lampert's incision. No?
Yeah, you told Lampert, so I'll give you 10 points for that. Okay. Second question, identify this incision. The question is Mr. Krishna.
Post-oral.
Post-oral incision.
Does it have a name? I'll give it to you for post-oral, but it has a name.
I don't remember it.
Okay, it's Wilds post-oral
Yeah,
incision.
yeah.
At least,
While,
if not the
yeah.
name, you should tell the what condition, what surgery it's used.
Yeah, it can be used for first for mastoidectomy, mastoidectomy.
Okay.
Cortical mastoidectomy.
Okay. Next one.
Okay. Identify this incision. The question is to Mr. Narayanamurthy.
Rosen's transtympanic implantation used for myringoplasty or tympanoplasty.
Very good, wonderful. It's a through meatal, per meatal incision, right? Presents?
Yes, transtympanic.
Wonderful. Good answer. Why it's used?
It is used for myringoplasty or tympanoplasty, reconstruction of ossicles, or just to sometimes in case if there are canal wall down surgeries, then you can also use it for application of window medicine in the secondary tympanic membrane. If
Excellent.
canal wall down surgeries are done.
Excellent answer. Good. Next one. Just a second, some technical is there. Just be with 30 seconds. Narayan, what other incisions you know for myringoplasty?
For myringoplasty, you can do even this thing, sir. Lempert's one
Okay.
to increase the widen the net of the tympanic membrane.
Okay. What are the types of myringoplasty you know?
Myringoplasty, there is myringoplasty or tympanoplasty, sir?
Sorry, tympanoplasty. Yeah, it's a type of
5 types are there, sir. 5 types.
Okay. These are very important questions. Okay, what I'm asking simply not for the sake of asking. These are the inevitably asked questions. What I'm telling you. Okay, please try to answer. 5 types.
Type 1 is just the reconstruction of the tympanic membrane, that is myringoplasty. Type 2 inspection. Type 2 is where it is reconstruction of along with the reconstruction of it is placed over incus, the graft, and type 3 is it is placed over tapees, and type 4 is I don't remember type 4. So type 5 is where you close the oval window and open the close the oval second the round window and then open the oval window so that there is phase difference. And type 5 is Lempert's fenestration operation, where you can incision on the.
Aditi, you agree with him?
Sir, type 4 is where the graft is placed over the round window and oval window is left open. And type 5 is the fenestration operation. There is also type 6 tympanoplasty, in which there is sono inversion, where the graft is placed over the oval window and round window is left open.
Akshay wanted to add something. Akshay?
Yes, sir. Type 6 is the sono inversion where it is the reverse of type 4.
We told that. Yeah. Good. Next question.
So this question is right?
Yeah.
Okay. Okay. 10. Next question to Mr. Ashwin.
Ashwin, very simple one. Where the incision was put there? That is the incision name. Ashwin, are you there?
ALR incision.
Yeah, you're right. What part of the ALA?
Anterior.
Okay. It's a bit tough one. Okay, anyway. Anyone else want to try? Okay, tell me for what reason it's given incision.
No.
Anyone else? Krishna?
Sir,
Sukshma? Kunj, anyone? Try.
Furuncles.
No. First time a clue is for rhinoplasty. See, okay, I'll tell the answer. This is called marginal incision. Okay, for it's usually given the lower end of the lower lateral cartilage. Okay, for rhinoplasty. Okay, nowadays this rhinoplasty and all coming in a big way for cosmetic surgeries and all. So we thought we will include. Okay, we should be knowing this. Next.
So should I give points for this?
No, not this.
Oh, okay, fine.
Ashwin himself will take more points. Yeah.
Next question is from Miss Aditi.
It is Killian's incision for submucosal resection of septum.
Very good. Wonderful.
Do you know any other?
Friar's incision for at the lower end of the caudal cartilage for septoplasty. Lower lateral cartilage.
Okay, and can you mention 2 or 3 differences between septoplasty and SMR?
In submucosal resection, the mucoperichondrial flaps of both the sides are raised, and all whole of the septum is removed, but the dorsum is preserved. And in septoplasty, only one side, mucoperichondrial flaps are raised only on one side of the septum, and only the unhealthy part is removed, the diseased part is removed. It is more of conservative surgery, means we preserve more of the healthy part in septoplasty.
I'll give that to you. Next question for Mr. Krishna.
Yeah, this is Freer's incision.
Okay, does it have another name? Freer's? No, what else is it called?
Other name, I don't know. Use.
I'll agree with you. Okay, fine. It's actually called as a hemitransfixion incision. The next question is for Mr. Narayan Murthy.
Tracheostomy.
Okay. Kishan sir, do you have any questions? Anything else? Okay, I'll give it to you. It's for tracheostomy and for cricothyrotomy. Next question is from Mr. Ashwin.
It's for radical neck dissection.
Name the incision. You want to answer this, or shall I pass it?
You can pass.
Okay, Mr. Akshay Krishna,
It
can
is a
you
McPhee's
name the
incision.
incision?
McPhee's incision.
Yeah, right. Who answered that?
Akshay, myself, Akshay.
Oh, okay. We've come to an end of this round also. So next question is for the audience. Identify the given incision.
Schobinger's incision. Schobinger's incision
What?
for neck dissection. Schobinger's incision for neck dissection.
No, this is not Schobinger's. Anyone else?
Is it modified Blair incision?
No. Okay, I'll put out the answer. It's Martin's incision or Kocher's incision.
Okay. What other Cox incision? It's Cockers, okay, not Cochers. Cockers. It's pronounced Cockers. Okay. What other Cockers incision you know? Anyone?
Coker's incision for a cholecystectomy.
Very good. Tell me. I'm a blind examiner. Explain me.
Along the right
How do you do
subcostal.
for cholecystectomy? Okay. Right subcostal incision. That's a Cockers for cholecystectomy. Any other Cockers incision?
For thyroid.
One more, you know, in
surgery.
ENT only. Thyroid. Where is that? How is that? How is
Transverse
thyroid
incision,
incision?
neck.
Cockers incision made. Okay. 2 finger width above the suprasternal notch. Okay. A transverse incision between the some anterior borders of the sternocleidomastoids between. Okay. Then we can extend up to the post border if you want for the better this thing. So many Cockers you should study in one or the other exam. It will be asked in a surgery maybe. What are all contribution Cocker? All the instruments, retract, everything you should be knowing. Next question, please.
This is again an audience question. Identify the given incision.
Yeah, this is a simple one and good one. Anybody can try.
Modified Blair.
Sukshma, very Sukshma. Sukshma is missing.
Yes, sir. Yes, sir. I'm here.
Answer.
Modified Blair for
Yeah, Rishabh is telling
parotidectomy.
it's lazy as incision. Okay, yeah, it's modified Blair's
Lazy.
or lazy as incision. Correct. Both are correct. So, for what surgery it is used? Rishabh?
Parotid.
Parotid. Okay, and parotidectomy it's used. Very good. Okay, why is the incision is like that? Why it's not straight?
To
Any idea?
avoid the cutting of
You need
auric.
to facial nerve. Can't hear you. Okay. We'll go to the final round. Priya?
Yes, sir. So before the final round, round 3, the score is as follows. Ms. Aditi has 20 points. Mr. Krishna has 20 points. Mr. Narayanamurthy gets 20 points. And Mr. Ashwin, okay, doesn't get points for this round. Next is the clinical case round, where each participant will get one question based on a clinical case, which one should answer in a span of 60 seconds. 20 points for each correct answer, no negative, and no marks on passing. So the first question is for Miss Aditi. A 25-year-old lady presented with a history of bilateral hearing loss and tinnitus, which worsened during pregnancy. She can hear better in a noisy environment. She speaks in low, monotonous voice.
Otosclerosis.
Okay. Well, actually, there's another part of this question. I'll read out the whole question anyhow. So examination showed an intact tympanic membrane bilaterally and Rennie's test was negative bilaterally. And then this is the pure tone audiometry that is given. So your question is, what is the diagnosis?
Otosclerosis.
Okay.
AB gap is seen in the pure tone audiometry. It is conductive hearing loss because Renes is also negative. And AB
Okay.
gap is seen in pure tone audiometry. And
Okay.
along with AB gap, a dip at 2000 hertz is seen in the bone conduction curve. So it is
Okay.
suggestive of otosclerosis.
Okay. So, do you know what is the most common site of origin of this condition?
Fistula antifenestrum.
Okay. You're right. And do you know what is van der Waals syndrome?
In van der Waals syndrome, there is a triad of osteogenesis imperfecta, blue sclera, and otosclerosis.
Okay, you're right. So you get all the questions right. Okay. And so you get 10 points for this. All right. So next question is for Mr. Krishna. A 30-year-old gentleman underwent tooth extraction for dental caries and now presented with a tense swelling in the neck below the chin. He also complains of difficulty in eating, swallowing, and speaking. On examination, the swelling gives a woody hard feel on palpation, and the tongue is pushed upward and slightly backwards. And the image of the swelling is given. So your questions are, what is the probable diagnosis?
Ludwig's angina.
Okay. And what organism is responsible for this condition?
Streptococcus pneumonia.
It's not Streptococcus pneumoniae.
Staphylococcus.
Okay.
Yeah.
Do you know some more that can cause it?
Yeah. Hemophilus.
No. Is it like a purely aerobic infection, or can it be mixed?
It can be mixed infection. Pseudomonas, E. coli.
Fine. So it's a mixed one. And what criteria is used to diagnose this condition?
I don't know.
All right, no problem. But you still get marks because you diagnose it right. It's Goldring's criteria. You can name the criteria, okay?
Yeah.
So it was 24. Fine. See, it's mixed aerobic and anaerobic infection together. Fine, right? Okay. So, question number 3 to Mr. Narayanamurthy. A middle-aged man who smokes 10 cigarettes a day from the past 15 years complains of hoarseness and uses false cords for voice production. Indirect laryngoscopy showed swellings with hypertrophic ventricular bands hiding the true vocal cords. This is how it looked. All right. So, what is your diagnosis for this patient?
It is Rinke's edema with dysphonia plica ventricularis. Compensatory dysphonia plica ventricularis.
Very good. What is Rinke's space?
Rinke's space is subepithelial space in the vocal cords. It is a potential area for edematous fluid to accumulate.
Exactly. Good
And
answer.
what is this dysphonia plica ventricularis? Can you elaborate on that?
It is because when there is when the normal vocal cords, true vocal cords aren't able to perform well. So this function is taken up by the false vocal cords. So they produce the thing. It is more hoarse, but it somehow compensates for the voice.
Okay, yeah, right. You get full points for this. So the next question is for Mr. Ashwin. A 67-year-old woman complains of sensation of room spinning for the past 4 to 5 days. She denies any trauma, head injury, syncopal episode, chest pain, or new medications. She states that the episode lasts for 30 seconds to 5 minutes time, during which she also feels nauseated. She also feels a ringing sensation in her ears and has muffled hearing. What could she be possibly suffering from? And mention a few differential diagnoses.
Benign positional vertigo, BPPV. Benign paroxysmal positional vertigo.
Is that your diagnosis?
Yeah.
It's simpler than that, Ashwin.
Yeah, it's okay. What is characteristic of benign, BPPV?
Change in the posture, the patient experiences over time.
Okay, but here is she complaining of that as a characteristic feature. Do you have another diagnosis for this?
Venous.
Yeah, it's actually Meniere's. Okay. Do you know what is Tumarkin's drop crisis?
Tumarkin's crisis. There is drop attacks without any hearing loss. Only drop attacks frequently.
What is the treatment? What is the treatment? If you tell this, I'll give you. Meaniers.
Meniere's treatment can be either conservative or destructive. In conservative procedures, it includes saccule decompression and intratympanic gentamicin therapy. In destructive procedures, labyrinthectomy.
One maneuver is there, no?
So that's for BPPV.
BP.
Oh, that's BPV, no? Hallpix. What is that? I
Hepl-
forgot.
Heplis manual.
Dix Hallpix.
Oh, Heplis. What is
Heplis.
Hallpix manual? Maneuver?
It's for diagnosing the nystagmus.
Okay.
PPP.
Yeah. Yeah. Good.
Since you
Long
told
back.
BPPV, do you know which semicircular canal gets involved?
Lateral semicircular.
Posterior semicircular canal.
Posterior.
Heard
Posterior.
that. Yeah, posterior. Okay. And you mentioned about labyrinthectomy, right? Which drug do you give for that in chemical labyrinthectomy?
Step 2. Gentamicin.
Yeah, you give gentamicin. How is it administered?
It's administered by a microweek through grommet, which is inserted.
And where does that go? Through
Into
what
the
does that
round
enter?
through the round window. It enters the inner ear.
Okay, I'll give you 20 for this as well. So that's
So, we come to the end of the quiz, I think. Priya, when you count the final scores, I would like to say this is one of the brilliant set of people I have seen. Okay, like juniors, all four have done really well. Okay, I'm not just exaggerating, but the way they answered, their confidence levels, really is really motivating to even to me. Okay, Aditi, you did really well. The way you answered, like even before we put up the questions, you are ready with the answers. That were perfect answers. You are not hurrying. Instead, you are confidently answering. Okay, it's really good. Okay, but
Thank you,
yeah,
sir.
be sure before you answer. Okay, think twice before you answer anything, the exams especially. And good thing, all folks, they don't have any thought blocks or tensed forces and all. They looks very confident, relaxed, and they're answering really well. And even Akshay and Sukshma also answered really well. Like I think a scorer will have a tough time now counting. Priya, you feeling the heat? Yeah. Narayan did very well. Narayan Murthy, you're from Coimbatore, no?
Yes, sir. Government Coimbatore Medical College.
So our Srinivas sir's student, huh?
Yes, sir. He is surgery. He's in surgery. Same unit. We are from the same.
Okay, fine. Ashwin, you also did really well. MMC, I have a lot, so many friends there. All your teachers also, I know them very well. It's like my sister college. I studied in BMC, so BMC, MMC were like always together. And all your professors, I know them very well. You're lucky to get such professors and learn from them. Ashwin, study well, okay? Narayan Murthy also. Aditi, you did really well. Let's wait for the hook. And even the Krishna, Mangalore. I am also from Mangalore, dear. Okay,
Yes.
AJ Institute, all your professors, I know them very well. You were doing really well. Krishna, you answered well. All the best. Okay, do well.
Thank you.
Thank you, sir.
The final results, please.
Yes, sir. So there's a tie between Miss Aditi and Mr. Narayanamurthy because both of them have got 80 points. No,
Okay.
I'm sorry, sir, just a second. I think Narayanamurthy gets 70 because one round you've not answered one question. Okay, I'm sorry. It's Aditi with 80 points. Mr.
Okay.
Narayanamurthy and Mr. Krishna get 70 points, and Mr.
Okay.
Ashwin has 50 points.
Okay. So the best among all four today is Miss Aditi Malji. Congratulations, Aditi.
Thank you, sir.
And the second best are Krishna and
Narayanamurthy.
Narayana, second best. And the best of all, the third best is Ashwin. Okay, Ashwin. And already we have requested you. Please send your photograph, passport size photograph, and your details to us. We'll be sending the prizes and the certificates soon to you. Okay, please.